I want to welcome you to our third, actually, educational program sponsored by the H2O and the Association of Holistic Skincare Practitioners. And this year's program is focusing on the topic of balancing hormonal health. So I'm going to look at hormone balancing or hormone indicators from an external perspective. I will be talking about some internal influences because what we see on skin is often impacted by what's going on inside the body as well. Okay. So if we look at our body as a detoxification system, we really have 4 different pathways. We have our primary pathways, which are our colon and our kidneys, and we have our secondary pathways, which are our skin and our lungs. And skin, as you know, makes up about 70% volume in terms of organ system in the body. So when we see things coming out of the skin, acne, rosacea, inflammation, abrasions, bruises, is an indication that something internal, some type of internal inflammation is occurring. So if, for instance, if our primary pathways are not functioning in optimum, we're going to see these kinds of disruptions externally on the skin. And we know that we have some work to do with the primary pathways in order to be able to fix the problems that we're seeing externally. So just a little bit about the anatomy of the skin. The 2 things I want to point out to you is we have 2 different layers of the skin. In aesthetics that I'm interested in, the epidermal layer, which is the very top layer of the skin, and underneath that the basal layer, which is the live layer of the skin. The epidermal layer is a dead layer of the skin, but it accumulates with debris from the environment coming at us, things we put on topically, but it acts as a barrier for us in many ways to protect the skin from damage, from the sun, from things coming at us that we have no control over, hydrocarbons, lead from the streets, chemtrails from the planes going overhead. The epidermal layer also, though, can become a little thick and congest the skin, and that's when we see acne-type lesions or rosacea come out. So the important thing from an aesthetic point for all of you to think about is it's important that we are looking at exfoliating techniques to make sure we're exfoliating and making that epidermal layer a little bit thinner, and therefore through the stimulation of exfoliation, we'll talk more about that later, we're going to increase the number of fibroblast cells bringing collagen to the surface, and the collagen is the plumpness and the elasticity in our skin. So as we age, collagen becomes very important to us. The other thing I want to point out is we also have something called melanocyte cells that are stimulated or triggered by sun. And the melanocyte cells, as they travel to the surface, can take many, many years, but they come out to the surface in terms of hyperpigment spots, brown spots on the skin. And what those brown spots are, people refer to them often as age spots. They are protective spots. They're protecting our skin from sun exposure and sun damage. But it's not necessarily something we want to see all over our face. We're going to talk about some options on lightening those areas and blending them back into the skin tone. Okay, I want to talk a little bit about internal factors influencing skin health first. Many of you, I know in the audience personally, have genetic methylation issues. And we're not metabolizing vitamins, nutrients, minerals, our foods correctly in our methylation process. And most of you have probably heard a lot about MTHFR. It's a gene that can be triggered off. You inherit genes from your parents. And sometimes different exposures can actually trigger these genes off where there's a breakdown somewhere in the methylation cycle. It's only one enzymatic genotype that can break down. There are lots of others, and we're going to hear from Dr. Gerald today about the methylation cycle, so I'm not going to say much about that at this point, but that's a big internal factor that can influence skin health. Stress. I mean, who doesn't have stress in their life, right? Buying a home, having a baby, raising kids, working, you name it. Oxidative stress is probably the most, aside from sun damage, the most damaging to skin externally that we see happening on the surface of the skin. Lifestyle. Donna Hetrick is going to talk to us later about some healthy lifestyle alternatives to incorporate in our lives. Exercise, movement. Okay, that's all important. Perspiring, real important for the skin in terms of the detoxification process.
attitude, mental health ability, and that can be impacted by all kinds of things going on internally. Dehydration, drinking enough liquids and water and making sure that you're compensating for any caffeinated beverages that you're drinking. Vitamin deficiencies, improper diet and nutrition is huge. And I don't know if you've read anything about the Eat Right for Your blood type information. There are certain food triggers that certain blood types don't do well on digesting. There are certain things that we can become sensitive to if we're not already sensitive to, if we're eating them over and over at the same time. So improper nutrition is a huge trigger on the face, especially with acne. See a lot of dairy and gluten sensitivities popping on the face with acne. Alcohol and caffeine, both are alkaloids. They impact the thyroid and other endocrine glands, which also can impact skin. They're definitely a trigger for rosacea. Hormone imbalances, smoking just really sucks the oxygen out of the cells. And so if you know a smoker, you'll probably see the real crinkly lines around the lips and the real tight, deeper wrinkles. It's the cells have lost a lot of oxygen through that smoking experience that they've had in their life or been exposed to. Medication, medical conditions, drugs, even scarring from even ear piercings, the umbilical scar, all those can block things that can affect skin. Oral hygiene, and we'll be hearing from Dr. Sambatero, our biological dentist that's here. I'm so excited that you joined us today all the way from Maryland. He's going to talk about things that can impact hormones from a dentistry perspective, like implants, amalgams, and root canals, which I see quite a bit of in the nutrition response testing side of my practice, interfering with not only skin issues, but overall physical health issues. Okay, some external factors affecting the skin. These are things we really don't have a whole lot of control over. Sun damage, number one. The most important thing you can do for yourself is to protect your skin. Before you get any kind of treatment, use any kind of product, is to protect it from sun damage. And that means wearing a sunscreen, right? Currently, the recommendation is 20 SPF. I like to go higher than that on facial skin. If you're out and about, outside, doing physical activities, riding bikes, spending great time in the sun, you just want to make sure that you're protecting your skin. And where do we find that we age most as a woman? Face, neck, décolleté, hands, and arms, right? So all those areas need to be protected. Environmental pollutants. Just driving a car, we're going to inhale fumes that we can't control. Living in the world we live in, near airports, we're going to be exposed to all the chemtrails. Some things we can't control, but what we can control, we can minimize coming at us. Weather and humidity impact skin. Some people, especially with inflammation showing as rosacea on the face, are impacted by real cold or real hot temperatures, real humid temperatures. That can be a trigger for the redness on the skin. Misuse of products and also treatment modalities. There are some skin types where sometimes just doing less is much better. Rosacea is one of them. So you don't want to pile a whole lot of especially chemical toxins on top of them, or any stressors that's going to make it more red and irritated. Acne is another. Allergies and reactions to environmental factors or products. So many people are sensitive even to plant extracts. So you really have to be concerned about that as well as the chemical additives. So how do we achieve healthy skin? And when our skin is healthy, and it's not inflamed, and we're feeling good, most likely our hormones are not, way out of whack, right? They can be, but typically we're going to see that on the skin if that's the case. We're also going to see it in our mental health situation and how we're feeling, if we're feeling depressed, if we're feeling tired. But in terms of skin, healthy lifestyles choices would involve like proper diet, nutrition, definitely hormone balancing, and you're going to hear from Dr. Sheets next, who is our expert on bioidentical hormone therapies, which I'm so glad he's here to join us. And a good daily skincare hygiene without a lot of irritants that are going to irritate the skin. Definitely professional skincare treatments, so you can deep cleanse the skin, you can exfoliate it more deeply than you can at home with a traditional scrub. What it does for us is it increases our cell turnover rate and it stimulates collagen. And if we stimulate collagen, it's a more youthful appearance on the skin. Okay. There's a list of toxic ingredients to avoid in topicals. You can Google, toxic ingredients to avoid in skincare. If you can't pronounce them, it's a good bet, safe bet that you shouldn't be using them. Basically, I'm not going to go over all of them, but sodium lauryl sulfite, I'll point out, is a real harsh detergent. It breaks down the integrity of the skin and creates fissures and deep lines and fractures. We get a lot of parabens up top that you have to look out for. Alcohols actually dry the skin. So if we're using a lot of alcohols on the skin, if I have someone I'm working with acne, it's actually working initially for them, but what happens is it's kind of tricking the skin. It's tricking the skin into thinking, I'm really dry, I got to step up this oil production. And so the oil production will step up again, and you're going to get more problem with oil coming to the surface and creating congested skin types. So these are mineral oil, although that's a natural product that comes from the earth, it's not breathable. So it's going to block the skin from breathing, and that's going to cause congestion and problems. And the other one I want to point out is hydroquinone. It's a bleaching agent that's used in a lot of lightening products, chemically based. And hydroquinone is actually banned in all westernized countries except ours for causing cancer. So there's a lot of natural things that you can choose to lighten the skin and fade the blemishes without using something like a hydroquinone. Okay. So I'm not going to get too much into this because Don Hetrick's going to talk to us about diet nutrition, but what are some of the things that you can look at in terms of diet nutrition to help skin health? Okay, so some raw and lightly steamed vegetables, organic vegetables, and of course we want to go organic, at least with the Dirty Dozen by the Environmental Working Group. We want to buy those organic. Fresh organic fruits, grass-fed beef, bison, and poultry. And one of our vendors here is our CSA. It's a locally organically grown food, so she's going to talk to us later this afternoon about what they offer. Oily cold water ocean fish, definitely wild caught, not farm raised, because they're feeding wheats and corns in the feed for farm raised fish right now. Most of them genetically modified. Flaxseed and flaxseed oils, if you can handle flaxseed. Chia is also a good omega fatty acid substitute. Extra virgin olive, coconut, grapeseed oils, and Donna Hetrick has her Wild Tree booth here today, and she's got lots of grapeseed oils to taste, so I'd encourage you all to do that. And she's going to talk more about that later. Raw organic nuts, almonds, walnuts, Brazil nuts, of course, if we don't have an allergy to nuts. Seeds, sunflower seeds, whole grain foods, and purified water, antioxidant teas. You've probably seen the food pyramid by Joel Furman. It looks a little differently from the old USDA food pyramid, but you can see the base of that pyramid is what? Vegetables, right? Full of antioxidants. Skin loves them. And as you climb up, do you see grains on there at all?
Really hard to read.
Whole grain
Yeah.
potatoes.
Yeah. So they're not the base of this one. It's like a reverse pyramid. Okay, Mark? So what kinds of things impact hormonal balancing that we see in skin? Definitely choices of food. Sleep. Sleep is extremely important because you're producing hormones between 11 o'clock at night and 5 in the morning, so you need to be sleeping. Some medications and supplements. Birth control pills can impact hormones. Birth control devices can also. Exposure to toxins and chemicals. Some you can control, some you can't. The greatest thing to me is the day that I see True Green come in the neighborhood and start spraying. I know I'm going to have a problem for a couple days. But that I can't control unless it's my yard, right? Pregnancy, definitely a surge in hormones there. Age, stress, and illness can also impact hormones. Okay, so what should your daily skincare routine look like? You need to know what's in your products. Remember, what we put on is absorbed transdermally through our skin, so it's going to get into our bloodstream. we need an effective home care program because that represents 60% of the change you're going to see on your skin. Okay, so what you do at home is more of an influence than what others are going to be able to do to you topically. Okay, so you should be doing these morning and night. You should be cleansing your skin. You should be using a toner, and most people think a toner is good because it closes the pores. It cleans and closes the pores. But the most important part of a toner is once you strip your skin with a cleanser, you're changing the pH of the skin. You're making it more acidic. So with a toner, you're neutralizing it and bringing that pH back up to encourage healthy cells to come to the surface. So toner is very important to put into your daily routine. Vitamin C serum or some kind of lifting serum with vitamin C to help repair sun damage. It's a brightener. It helps with blemishing. And then there are targeted serums you can use, like a pigment lightening serum on spots if you're doing spot treatment. There's masks that you can use. Moisturizers for your skin, and depending on how much moisturizer you use, there are different types of moisturizers that may be better for you than others. Definitely an eye cream for those fine lines and wrinkles to help kind of rejuvenate that area. And don't forget the lips, moisturizing lip balm. What I don't have on there is always take care of your neck, your arms, and your hands at the same time. So with a professional skincare treatment, that's going to really represent about 40% of your improvement. And depending on the type of skin and the condition that's presenting, normally it's a monthly type of exfoliation process. But that can vary based on what your skin is presenting. So during that consultation, you need to really talk to your esthetician about any health concerns and complete like a health history so they know if you have hormone imbalance, they know if you have an autoimmune condition, they know, because all of those things show up on the face. Right? Cleanse, evaluate, and document the condition is what an esthetician would do. They should be talking to you about treatment plans, about what they see and duration, and also reviewing a good home care plan for you to do at home. So frequency, again, will depend on age, skin type, and condition, and the goals that you're trying to achieve. Cell renewal factor I want to talk about. The skin actually has a cellular turnover rate. And when we're babies, it turns over in about 14 days. So when babies are wounded or they have abrasions or injuries, you can pretty much see that they heal within about 14 days. Well, as we age, that cell turnover rate is slower and slower. So our goal is to stimulate that cell turnover rate to be faster, because what we're concerned about is producing collagen from the live layer of the skin. And the only way to really produce collagen is to stimulate it in the live layer. And so by the professional exfoliation treatments, if you're getting peels or enzyme treatments or using electrotherapies, that's the goal of stimulating that cell turnover rate in adults. You can see as you get into adult age or 50 plus, you're looking at all the way from 14 days to 42 and 84 days. So that's why we start aging and wrinkling, because our cells aren't turning over quickly. Okay. Okay, we saw that one. All right, so I just want to talk about some common skin conditions to show you what's happening here. There are different types of rosacea. This rosacea, you can see, results in flushing and redness, stinging and burning, and sometimes scaling. Can you see that picture real well? Okay, the redness. That's an indication that, you know, there could be a topical thing irritating it, but probably there's something internal going on that's increasing inflammation in the body and presenting this on individuals. Okay, one of the real common one is the papulopustular rosacea, and you're going to see little bumps and pimples. So people might call it acne, but it's really not acne. It's a rosacea presenting on the face. This one is people refer to as the bulbous nose. I think I was 12 years old when I met Tip O'Neill, former Speaker of the House. And the only thing I could stare at was his nose, because I'd never seen a nose like that. But he had this type of rosacea. And you see the real thickened skin. Mostly this presents in men. You can see the shape, this shaping of the nasal area. And ocular, the red eyes, the scaling around the eyes, it's another form of rosacea. Now, if we were to simply approach a patient like this from the standpoint of an external treatment, we're not going to be able to resolve all these issues topically. There's something definitely going on internally. Okay, so rosacea is a chronic inflammation. Something's going on internally. It's a very common thing. About 14 million Americans experience rosacea. Typically, it doesn't develop until after the age of 30. And it's seen more in women, but when it's seen in men, it's more pronounced, like the bulbous nose feature, right? Condition has to be managed. It's not something that, it's just a management issue with rosacea and acne. Now, if you're fortunate and you can identify the internal triggers, it's much easier to manage. And so that's when you work with your other healthcare professionals to do that. Regular skincare treatments are recommended. And less is better in rosacea in terms of skincare products. I would probably just do a cleanser, maybe a toner if it wasn't irritating at that point. And maybe a low-dose vitamin C serum with a light moisturizer. That's it until the condition is managed, because otherwise it feels like a ball of fire in the face when you're putting too many products on it. Okay. Sun exposure, these are triggers. Sun exposure, heat and water, stress, wind, heavy alcohol use. Even one glass of wine can trigger a rosacea flare. Caffeine, cold weather, spicy foods, marinated meats, dairy products, gluten and sugar, humidity, certain fruits and vegetables, some skin care products, and medication and illnesses. Also alkaloids, aside from the caffeine. I don't know if I put chocolate up there, but chocolate can also flare rosacea. Okay, talk a little bit about acne. We have 4 grades of acne. Grade 1 is just general redness, little blackheads and pustules. So you just have a few of them. Grade 2 is when you're seeing a little bit more like 10 redness, blackheads, inflammation, pustules, and white pimples or milia. Milia are the real hardened oil deposits. It's hard to get out of the skin, normally around the eye area. Common acne conditions for grade 3. Same as grade 2, but more. You can start to see some bumping in the pimples. And grade 4 actually almost looks like a bacterial infection on the skin, and can be in many cases. And that's when you're getting into cystic acne and you're worried about scarring at that point. This is 2 of my clients. One you can see on the left-hand side has raised red bumps. Now, with her, she had a couple food triggers. When we energetically tested her, we found her sensitive to milk, dairy, and gluten. But she also had an egg-laying parasite, we found. So it was much more than topical treatments with her. We had to look internally with what was going on, because she wasn't improving with just topical treatments. The one on the right also had a parasite and also had a dairy intolerance. So she had a microscopic parasite. And you see the difference? One looks like a red raised tunneling effect. The other, okay, so this one's dealing with an egg-laying parasite. This one is a microscopic. All right, so you can see the change in about 8 weeks.
That's amazing.
But she had to be very compliant with her diet, because what feeds parasites? Sugar and dairy. Okay, so she really had to cut the sugar and the dairy, and in her case also gluten, and she was really good. You see the one on the right? Same thing, very good with the diet, so quick turnaround. All right. Now, if you notice on both of those women, they had congestion shown in different facial zones. And that kind of tells me what's going on in different facial zones. So they had congestion in the lung areas by the cheeks. They had congestion in the reproductive area on the chin. So I knew there were some hormonal imbalances occurring. They had some things going on in the stomach and on the top in the small intestine. So that tells me right away that there's a food trigger for sure, because we have colon and small intestine and stomach involved. All right, these are also common skin conditions related to sun damage. The picture on the right is under a wood lamp. So you can see underneath the skin in terms. Go back. And underneath the skin in terms of where the damage is occurring. Picture on the bottom, you can see the hands. That's an example of a hyperpigmented area, the H spots. And those, by the way, can also be lightened, so with treatment. Also the décolleté. You can see on the décolleté, this is an example of actinic keratosis. It's a precancerous condition. On the right, that's actually hypopigmentation. You see the white spots? Okay, that can't be reversed. When we see white spots, that means we have no melanocyte cells left in that area coming to the surface. So we need to make sure that you are definitely protecting that with sunscreen. Traditionally, a dermatologist is going to burn off or freeze off. What freezing does, it kills the tissue around the cells. So you're more likely to hypopigment white spots with the freezing technique. So you want to make sure if that is occurring, you need to be protecting that area. Okay, this is Marta. Thank you, Marta, for letting me use your picture up here, wherever you are. She's at my booth. She'll talk to you about the products and the program. So you can see, it's kind of hard to see when we started with the hyperpigmented area around the ring of the face, the deeper lines in the eyes, and now the progression of lightening. Okay, go ahead. Thank you, Christy. Another person allowed me to use her picture here. We can say in July of 2012, we had a lot of sun damage occurring on the skin, and now in April, we've been able to, with good product management and treatment, lighten that whole area. Okay, so sun damage. That's what we see coming 18 years later after we've lathered ourselves with baby oil and iodine when we're younger, right? You're seeing the fine lines and wrinkles. Okay, another condition, Michael Jackson had it. You can see it can be caused by genetics, oxidative stress, or autoimmune deficiencies, also viral. I think he was probably involved with some skin bleaching. At least that's the rumor. But you can see the lightening of the skin. It's called vitiligo. Okay. Eczema, very common to find on children, especially with allergies, asthma. Also can be a sign of congested liver issues. So diet and topicals have a lot to do with eczema appearing on the skin. I just wanted to show some pictures of what it looked like. Okay. Of course, the one up top, you probably, if you've had poison ivy, noticed that one, the blistering of the skin. And then dermatitis on the bottom. And usually when the skin is presenting with this type of infection, there's something that's bothering it internally. So it's something you're eating. It could be something in processed foods. It could be something that's causing you an allergy. It could be something you're touching outside. Really, the big mystery is to find out what's causing this to occur on the skin, because your primary pathways aren't handling it, so it's coming out of the skin. I don't know if you've seen on the slide on the left. This is a type of dermatitis on the legs, and then a vascular dermatitis on the right. And again, all of these are internal triggers, most of them. Okay, so common conditions or eczema triggers include soaps that are irritating. Sodium lauryl sulfide is a very harsh detergent, added things in many of our soaps and detergents on the shelves. Chlorine, dishwashing detergent, sometimes juices from meats that are injected in the factory farm meats can cause an eczema reaction. It's genetic often. It's seen in families as well with a history of allergies. Can be caused from allergies that are hard to control, like dust mites and pets and pollen and mold. Can be viral, bacterial, and also food-related. Dairy, eggs, nuts, and seeds. Soy and wheat are common triggers. Psoriasis, another condition on the skin. You can see the plaque psoriasis up top, and you can see the one on the trunk that's related to the gut area. A couple other forms of psoriasis that you might see related in papules and pustules occurring. Go ahead. And of course, psoriasis is triggered from, this is a very rare form of psoriasis, but I'm sure you've seen it. It's a plaque psoriasis, but it's triggered from stress, skin trauma, medications, also often infections, and commonly associated with diabetes, heart-related conditions, and depression. Okay. Facial warts, so see facial warts too, and it's basically if you're looking at it under a microscope and you see a black peppery kind of texture, it's most likely a wart. This is also internal and systemic virus. It's extremely contagious, so if I do see a facial wart, I usually will stop until that's treated and any treatments that I provide. So I don't want to share it with the rest of my clients. Go ahead. Okay, this is a real common one, the chicken bumps, the keratosis pilaris on the arms. And typically that's related to a vitamin A deficiency. But it affects quite a lot of our population, like 50% of adolescents and 40% of our adult populations. And this common condition I see quite a bit, especially with college kids for some reason. I think it's probably the processed diets they thrive on. But this is a fungal infection called Tinea versicolor, and it's a yeast overgrowth. So what things trigger yeast in the body and diet? Sugar, alcohol, dairy, gluten, right? Okay. Cancerous, basal cell carcinomas. You see a couple examples. The one on the left is a little whitened spot. It's kind of hard to see. The one on the right is actually raised. The one on the left actually looks almost like a frostbitten texture. Go ahead. Melanoma, of course, we see that. I mean, both of those types of conditions, you definitely want to see a dermatologist right away. Mm-hmm. Okay. Is Anne here? Let's see her. Well, she allowed me to share these photos with her. I wanted to show you an accident happened to one of my clients where actually she cut herself all the way to the bone in the brain. You could actually see the inside of her head. And she had a very good doctor, luckily, that was real careful about stitching her up. Did a wonderful job. But as soon as that stitching healed and we just had red tissue, we started using a product, a scar relief formula product. And you can't even tell now that she's had that. So that was from September to December.
Wow.
Mm-hmm. Okay, so the other part of my business is nutritional response testing, because I began to realize, early on that I couldn't really achieve results just working externally. I had to look internally, and I was trying to determine a way that I could do that was not invasive, and I came across this technique. Used it a couple of years with my family and really saw dramatic results, and it's simply a clinically designed nutrition applied kinesiology method. It's not invasive. It looks at the body's neurological reflexes and acupressure points. And it points, they relate to specific functions in the body. So the techniques derive from traditional Chinese medicine. And it went really well with the work I had done already in my acupressure training. So I really like this technique. It helped determine the state of health and the flow of energy in the body, and it identifies stressors on the body that can actually be barriers to someone healing. So at first I started working with just primarily skin with this technique, but now I see people for all kinds of issues. It helps with increasing energy in the body, improving sleep, reducing headaches, strengthening the immune system, weight loss goals, reducing gas and bloating, reducing constipation, limiting eczema, acne, and other skin conditions, regulating digestion and bowel movements, regular bowel movements, helping with chronic pain, eliminating dependency on inhalers, improving focus and mental clarity, and reducing and eliminating acid reflux and bladder and yeast infections. I like this technique because it's really non-invasive. There are no needles, there are no blood draws. Quite a bit I refer back and forth to medical doctors if I feel that something energetically, their body's telling me something's happening, so that it can get medical treatment for that condition, or they can get a second opinion. It's a safe and easy way to look at food stressors, chemicals, heavy metals, chemicals, and immune challenges that maybe the body is struggling with. It's individualized, so every program is clinically designed for that individual. It provides an accurate assessment of what your body needs to support your body healing itself eventually, because our bodies are amazing things and they should be able to take care of what's ailing us. And sometimes those triggers, those barriers, are simple dietary adjustments. Sometimes they're exposures or heavy metal exposures that we work on detoxing. I mean, sometimes they're very simple changes. Sometimes they're more complicated. You know, we find that they're testing for products that may include genetic mutations in their methylation cycle, and so it just depends on the individual, what we're finding. Okay, so common skin, hair, and problems addressed with NRT, just to bring it back to skin. Dry spots on the face, acne, psoriasis, eczema, dry skin, itchy scalp, brittle nails, dry thinning hair, which often can be simple as a mineral imbalance in terms of the minerals feeding your thyroid, rosacea, inflammation, rashes, psoriasis, parasites, digestive imbalances, hormonal imbalances, and methylation challenges. These are just some testimonies from some of the people that I have worked with. Go ahead. Go ahead. So some beneficial lifestyle changes for hormonal health. Some things you can do at home, really simple. Replace your antiperspirants if they have aluminum in them. The body really isn't meant to detox aluminum, and so you want to remove aluminum from the body as much as possible. So ditch the aluminum foils and the aluminum cookware. Use tap water and shower water filters, because our water has chlorines and fluorines and bromines in it, and those hit our thyroid as we're showering, and guess what? They take up important hormonal receptors transdermally through the skin, and if you're drinking, internally. So you definitely want filtered water. Hydrate. Definitely want to be drinking lots of water, and we're going to keep filling those water containers today, so help yourself at any time you need them. Invest in a safe space EMF protection device. Some of us are very sensitive to electromagnetic fields. They come off our cell phones, they come off the high electrical lines, they're coming off the computers. I mean, we're living in such a technological era. We have all this technology around us, and blocking some of those EMF fields can help you with physical health issues, mental health issues as well. Don't wear underwire bras. Ladies, we're always pressing right on our spleen meridians right here all the time. Not a good thing to keep that channel open all the time. Get plenty of rest. You really should be sleeping by 11 and until at least 5 in the morning, because that's when you're developing hormones that you need. Eat clean, green, and get adequate protein in your diets. Especially as we age, we need more protein in our diets, and it needs to be good protein and protein consistent with our blood type, our blood chemistry that we digest, and avoidance of anything that we react to. Minimize our environmental toxic exposures as much as we can. Okay. Research our dentistry procedures with multiple dentists, right? And that's really important. Even technique is important, because if we have, for example, a dental amalgam that's bothering us, we get it pulled, and there's no safety procedures in place, that can actually make us sicker, because we're dumping more mercury into the system, right? And listen to your body. If you know something's not quite right, listen to it. You're intuitive enough to do that.